Joining us now, Dr. F. Perry Wilson. He's an associate professor of medicine at Yale University Medical School. Dr. Wilson, good to see you again. On this potential for a I think it's called the Tridemic, where you've got the flu surge, COVID, RSV. What are the chances of that happening this fall and winter?
Hi, Victor. I think we're pretty much already there. The reason I'm so concerned is that both flu and RSV season aren't supposed to be happening yet. Flu season really gets going late November and goes on through about February or March, sometimes later into the spring. RSV season, similarly, December, January is when we see peaks. And we're seeing RSV cases at peak levels right now. And we're already seeing a fair amount of influenza cases starting to come in as well. So the upswing is starting. And of course, COVID is still here. So we're seeing the pressure on the hospital system already with all these people admitted with respiratory infections.
I want to come back to COVID in a moment, but let's start here with RSV. And we heard from Rosa, obviously the pediatric beds are overwhelmed, filling with children who are going in for RSV and other things. But at what point should a parent say, right now, I need to take you in? You don't want to wait until your child can't breathe, but you also don't want to unnecessarily overwhelm the system. When should they go in?
Well, the important thing is to have a good relationship with your pediatrician if you have a child, because they can often walk you through those symptoms that are worrisome and those that you can safely just keep an eye on. I'm particularly worried about kids who are under 1 year of age. They are at the highest risk for complications from RSV, and they don't tell you that they're sick. But those kids less than 1 year of age are going to be lethargic. They might be inconsolable, crying. Even if you're holding them, they don't get better. Those are concerning findings. Difficulty breathing in someone of that age is going to look like retractions in the skin sort of pulling back between their ribs as they're trying to take breaths, and wheezing. Any of those signs, a really big red flag. So either call your doctor or get yourself to an emergency room.
Considering the age group you're most concerned about, the advice that doctors passed on to Rosa really doesn't apply to wash your hands frequently. You're not going to tell your 10-month-old every hour or so, go in and wash your hands. So what's the precaution for that age group?
No, but you're going to wash your hands on behalf of your 10-month-old. So RSV is common, and adults get infected with it all the time, which is probably why we don't get that sick. We have built up immunity to that, and we might be bringing it home from our workplaces. Older kids in the house can be bringing it home from their school. So you want to have everyone in the family doing their best to keep up hand hygiene. You know, we've known about washing hands for hundreds of years. It is really good advice, and it's the thing that's going to keep kids safest from RSV right now.
All right, now to COVID. The president is scheduled to receive his third vaccine booster, so this is shot number 5 now. He just had COVID end of July, beginning of August. So we're 3 months out from that. Is this the right time frame for most people to follow to get that booster after you've already had a recent case of COVID?
Well, the CDC recommends giving some time between a case of COVID. 90 days is the official recommendation before a booster. I will say that the boosters are looking a bit better actually now, because some of these new variants like BA.2.75.2 really show that they're evading antibodies from those initial vaccines and from people who had earlier infections. But those new variants are Omicron offshoots, which is what the updated booster was designed to target. So there's a good chance that this is going to get you an edge against some of the new variants that are coming in from Europe and whatnot. So seems like a reasonable idea for someone like the president who's shaking a lot of hands.
All right, good to know. Dr. Perry Wilson, thank you.